I knew I wanted to get into medicine. I had my unfortunate orthopedic issues, not only as a child, and my mom was also, unfortunately, was dealing with a lot of hospitalizations. So I was very in tune with the medical world and was raised in that, unfortunately, I guess, that environment. So I had the opportunity to see the hospital settings. I was in there often caring for mom. So that drove me into the medical world. I was fortunate enough to get into the University of Notre Dame for my undergraduate work. And then medical school, I went down to Missouri and did my residency up at Michigan. And from Michigan, I traveled out to the New England area, specifically the city of Boston, and did New England Baptist and Brigham and Women's Sports Medicine Fellowship before coming back to South Bend, Indiana. When I was young and looking for a job opportunity to come back to South Bend, I was offered various other opportunities within the region, and I don't believe that anyone offered the caliber of orthopedic care that South Bend Orthopedics has offered. And for me, that decision was easy to come back not only to my hometown and region, but South Bend Orthopedics specifically. Our name, South Bend Orthopedics, has been synonymous with great care over the last 7 to 8 decades. Things have definitely changed over the last 30 and 40 years, and I think we've brought that technology up to date where they laid the platform. We've just built upon that to a great opportunity for orthopedic care in the South Bend region.